All right, YouTube. Wanted to give a quick update to a procedure I had done yesterday. What they did was a nerve block at L5-S1. They didn't use, it wasn't an epidural steroid, and this was more of a diagnostic test rather than a pain management type thing. So the procedure lasted, I was probably in and out of there in 30 minutes. Once I got into the room, you know, they put the iodine stuff on your back, clean it. They injected a lidocaine pain med, and then they inserted the needle. You could feel, you know, pressure. They went in that sciatic nerve. And again, instead of injecting a steroid, they put in some kind of numbing medicine. So the thing only lasted for about 4 hours. And I want to apologize too for this crappy, the way I'm doing it, but I'm actually headed to work. When I got off the table, I walked back to the room and my leg felt super weird. Almost like it was just completely numb. It was hard to walk at first, but when I did some of the movements like hip lifts, hip heist, pelvic tilts, whatever you want to call them, which usually gives me a lot of pain, it was almost none. My hip pain that I've been having lately, that's been waking me up at night, it was non-existent. The shin pain outside of my calf, couldn't feel that at all. And so my wife drove me home. I don't know if I think I could have driven, but I'm glad I didn't. But when I got home, I did my little basic PT thing where I do some push-ups, get down on the ground, get up. And I actually videoed this a couple of days before I went so I can compare. And it was night and day difference. I mean, I was able to pop up from the ground like I was before surgery, even the first back issues. So I'll break it down as basically I felt like for 2 hours I was almost normal in no back pain and that kind of stuff. Now my legs still felt jelly for about an hour, and then even that went away. And then I want to say I had the procedure done about 3:30, and about 6:30 I started feeling the hip pain again, so I could tell that stuff was wearing off. But what what I'm hoping they do is say, you know what, you're right. It is the L5-S1 disc. We need to do a fusion there. And I feel like if we do that, I'm going to be back to pretty much normal, you know. And I don't know, I'm going to talk to them today. I'm sure they're going to do a follow-up, and I documented everything in my phone. I didn't have to change clothes. I wore athletic shorts, athletic socks, shoes. I even left the shoes on. They just pull your shorts down, you know, far enough to get to that spot. Did it hurt? It was kind of like an epidural. You felt a lot of pressure in your spine. I could feel like my big toe and the leg on fire, but I'd say it was like a 5 or 6 compared to when you have really bad sciatic pain. Or honestly, if that was like that for constant, that's what sciatic pain's like. I mean, but for 5 or 10 seconds you could take it. But when it's 24/7, day after day, it's nerve-wracking. So I guess that's the difference. That, I mean, I wouldn't be scared if you're worried about the pain of an epidural or any kind of nerve block. I wouldn't worry about that. It's not that bad. I mean, it's really nothing to it. You know, you endure it for 10 seconds and it's over with. Yeah, I got a little soreness where the shot was given today. But again, soreness has never really bothered me. Even after surgery, the soreness isn't that big a deal, you know. But I just want to give everybody an update, because I said, you know, I was hoping my last video would be a fusion and me saying, hey, I'm done. The pain's gone. Y'all can stop listening to me cry about being in back pain. But now that they've done this, I've got to add 2 videos, and we'll see what's next. And you know, I may do 2 or 3 more videos. Again, I'm not trying to make money, not trying to get a zillion followers, just trying to help educate people that are having back issues. And you know, maybe this test, you know, I don't think they use it very much, but maybe these guys are thinking, man, this is a great tool if we end up doing the fusion and they find out it helps, that, man, this was a great diagnostic tool to pinpoint exactly what his issue was, instead of thinking it's something else, or just wait longer and your L4, L5 didn't fuse right, and, you know, doing something like that. So I'm hoping, and again, I have no idea what they're going to say, but I just hope that based on this test and what I tell them, that they're going to say, man, we think we can fix this. And you know, I'm just ready to get it done. I'm ready to get back to doing normal stuff. And like I said yesterday, I had 2 hours being closer to that than I ever have. Now, why didn't I do the epidural steroid? Right now I'm thinking, dang, maybe I should have done it. That might have given me 6 months or 4 months or a year relief back to normal. But then I felt like, well, it's not, it may damage the disc because I'm feeling so good, you know. Like, I wanted to do so much stuff yesterday because I felt pretty good, but I knew I'd probably be hurting today, so I was smart enough not to do it. So that's kind of why I didn't choose the epidural steroid, because I feel like, you know, you're just putting a Band-Aid on something, and I want it fixed. I'm just tired of being in pain and the whole deal. So I'll do an update, you know, in the next couple of days, see what the doctor says, probably combine it all. Again, if you got any questions, let me know. Back pain sucks, and hopefully everybody can find a way. But again, you got to be an advocate for yourself. I really pushed for this test over the epidural, and I just felt like, you know, that's what's best for me. Thanks.